Well, a very good afternoon to everybody joining us from America and a good evening to those based in the UK. My name is Jo Nussbaum. I am the Director of Communications for the Legatum Institute, and it's my pleasure to welcome you to this webinar today to showcase our United States Prosperity Index and provide a bit of a sneak peek into some of our county level analysis for Iowa. To provide a bit of background for those of you who are not familiar with us, the Legatum Institute is a London-based think tank with a global vision to create a movement of people committed to creating the pathways from poverty to prosperity and the transformation of society. Our work is really focused on developing the practical solutions and data tools that will help build inclusive and peaceful societies with open economies and empowered people. And as part of that, our Centre for Metrics creates indexes and data sets to measure and explain how prosperity is changing, and that includes the US Prosperity Index. We're very grateful for the generosity of the Helmsley Charitable Trust, the Robert Wood Johnson Foundation, and the Walton Family Foundation, which has allowed us to draw on our 13 years of experience measuring prosperity globally to create this holistic and comprehensive analysis of how institutional, economic, and social well-being are evolving across the 50 states of the Union and Washington, DC. As part of this programme, we are also undertaking some detailed county-level analysis for 8 key states, including Iowa. That work is actually not going to be published until next month, along with this year's update of the state-level index, but we're delighted to be able to offer you just a few insights from that work during today's event. We really hope you're going to find this useful to consider how Iowa can emerge more prosperous from the current health, social and economic challenges it's facing. We'll put up an agenda of the running order for today's events. As you can see, we will have some speakers from the Institute, but in addition to that, we will then have some exceptional panelists who are joining us today. So it's my great pleasure to welcome Christina Moffatt, who is Director of Small Business Resources at the Greater Des Moines Partnership, Dr. Keith Mueller, Director of the RUPRI Center for Rural Health Policy Analysis, and Bill Menner, Executive Director of Iowa Rural Development Council. Thank you, all three of you, for your time today. We're really looking forward to hearing your reflections on the index and the challenges and opportunities facing Iowa as you see them. Following the presentations and some reflections from the panelists, we'll open up the floor to questions from the audience. So please do use the Q&A function at the bottom of your screen to pose questions throughout the event. It would be really helpful if you could include your name, where you're from, and who your question is directed at. And just apologies in advance if I'm not able to ask the speakers and panelists your questions, but I will do my best to get through as many as I can. There's also the chat function if you've got any general comments you wish to make, and where you can exchange thoughts and ideas with all the other attendees. But without further ado, we will kick off today's session with an introduction to the US Prosperity Index from our Director of Policy, Dr. Stephen Brien.
Jo, thank you very much, and good afternoon to all of you. It's my real privilege and pleasure to be here this afternoon and to give you a bit of an overview of the work of the Institute, and really to start with explaining what we mean by prosperity. Because for us, prosperity is a multifaceted issue that really needs to get tackled around the world, looking at both economic and social well-being. And I think in today's world, if we think about the events of the last few weeks, but also the pandemic of the last few months, it has really been brought home to us that there is so much more to life than simply material well-being and simply looking at GDP numbers. And our work on prosperity is very much around defining what that means, measuring it, identifying opportunities and challenges, and Shaun will take us through more of that later. But I thought I'd take this opportunity to unpack what we understand prosperity is, how we look at it, what are the components of it, and from that, the potential to set agendas for going forward. Now, Jo has highlighted 3 areas, 3 what we call domains of prosperity: an institutional domain around what we call inclusive societies, an economic domain, and also what we call empowered people, which is really around people's lived experience, health, education, living conditions, and of course the natural environment. But let me take that now to a layer more details and look at how we define prosperity as a concept which we then measure. As I said, 3 domains. So starting on the left-hand side in the blue, inclusive societies. And that looks at institutional structures, meaning all those different ways, both formal and informal, in which people engage and interact with each other. So we think about safety and security. Is the state peaceful? Does it have low levels of violent crime and property crime? Then we look at freedoms, civil rights, social tolerance. To what degree is there agency? Do people actually have real freedom to pursue their interests? How much discrimination is there? Is there a high degree of social tolerance? Then we look at governance, which includes the level of accountability, integrity of government, the level of corruption, etc. And then finally in this domain, we look and consider the strength of social capital. So are families strong? Are there bonds of trust between neighbours and strangers? Is there confidence in public bodies such as the police, government, courts, the media? Now the next domain, the middle domain, orange, open economies, looks at the economic structures. So how robust is that economic engine? So firstly, the business environment pillar looks at the rules and regulations that determine what it takes to start, to grow and develop a business, from access to the labour market, access to finance, regulatory issues, occupational licensing, etc. Then we look at the quality of infrastructure and market access. So is the base of transport, communications, electricity, water, etc. available to companies to actually help them build, develop and deliver services and products? And then finally, we look at economic quality in terms of the employment levels, how productive and competitive it is, and also how sound the fiscal setup is. Does government have a lot of debt? Is there high inflation, etc.? The last domain, empowered people, in green on the right, is where we capture, as I said, the lived experience of people. So their social well-being, which can be some of the real drivers of life satisfaction. So that would include their living conditions, including their poverty rate, health, education, natural environment. Now the outer ring of this diagram has highlighted 48 elements of prosperity. And these for us are the building blocks. They're quite specific, policy focused. So, within health, we look at behavioral conditions. We will look at preventative interventions. We look at care systems. Or within education, we look at pre-K. We look at adult skills. And by putting all this together in a consistent way, not only are we able to aggregate to measure prosperity in a whole, but also start to explore the relationships that we see. So for example, the relationship between degrees of social tolerance and a sense of freedom and the strength of social capital in a society, or indeed even the levels of poverty. Or if we're thinking about the COVID situation, looking at the quality of care systems and preventive interventions, and how's that related back to the quality of governance in a state as you start to think about how you manage these more challenging times. So that gives us a sense of what we've been looking to measure at the US level. Now, of course, as Joe mentioned, for the last 13 years, we've been doing just that at a global level. And when we look at the US at a global level, what we've seen, unsurprisingly, is that the US is one of the world's economic powerhouses, ranks 4th in open economies. But on the other areas, it's not uniformly successful. So this is our prosperity index at a global level. And sorry, the quality of the screen isn't great, but you'll see there we've highlighted the United States coming in at 18th overall. And again, you'll sort of see the shadings of those different pillars give you an indication of how successful or challenged different areas are. And just to let you know that from a global perspective, the US is comparatively weak in safety and security, coming from high crime levels, comparatively weak in health, coming from an uneven distribution of services and access. Obviously, within the health system in the US, there are some of the best care, the best R&D, the best hospitals in the world, but there's also some of the most uneven performance for a major country. And it was really that uneven performance that struck us as being something that, because the US being a federal country and is so large, it's not always relevant to think about a single US figure, single US metric here. And that really prompts us to think, could we look at each state, or perhaps, as Joe has already indicated, even more granular down to county level to understand what's going on at all these levels? If we want to unpack the US story, work out what's needed, we really wanted to get under the skin of this. So we looked around and we could find plenty of measures, the freedom of the United States, the county health index, many areas focused on specific dimensions, but nothing that really captured the essence of prosperity across the country. So hence, and this is the second year we're doing it, we've been publishing the US Prosperity Index. It captures the domains we're talking about, it captures that framework we talked about, measures every state against the others, starts to put a ranking together, provides a shape, and in effect, the DNA of every state that then can get unpacked. But before we go into the details, which Shaun will take you through, I'd like to start with a short video that highlights some of the key findings over the last year from us looking at prosperity across the United States.
The Legatum Prosperity Index shows that prior to the COVID-19 pandemic, overall prosperity in the US had been rising for the past decade, although long-standing challenges mean that prosperity was not experienced equally by all Americans. Although the country was ranked high for economic pillars, it was falling behind in living conditions, health, and safety and security. Our US Prosperity Index shows that the country's economic quality had improved as unemployment had fallen after the financial crisis. This meant it was in a strong position before the virus hit, but of course that strength is now at risk. Improvements in education and living conditions had also been significant in driving the growth and prosperity over the past 10 years. Although education had been improving, school closures as a result of lockdown measures put the progress made on educational outcomes at risk. More positively, one area of living conditions that had improved significantly over the last decade was connectedness, with access to broadband rising in both rural and urban areas, enabling greater connectivity during lockdown. Health in America had improved over the first 8 years of the past decade, so the country was in a good position to deal with the impact of the pandemic. However, the mental health of Americans had already been declining even before the coronavirus crisis. There had been large increases in drug overdose deaths, rates of suicide, and levels of serious mental illness across all regions, with 48 states seeing mental health decline over the past decade. Deteriorating social capital was also impeding further prosperity. While personal and family relationships had strengthened, social networks, institutional trust, and civic and social participation had all deteriorated. The fact that only 11 states had seen an improvement in social capital since 2009 is a real concern, given strong communities are the cornerstones of society, and the decline in other states is indicative of societies that were already coming apart rather than drawing together. Despite these national challenges, the US Prosperity Index shows that before 2020, prosperity had improved in 47 of the 50 states, plus Washington, D.C., providing a strong foundation on which to build a recovery as the country emerges from these challenging times. But while all but 4 states had seen prosperity improve, no single state has yet succeeded in fostering a high degree of both economic and social well-being for its entire population. Other than top-ranked Massachusetts, no state ranked above 20th in all 11 pillars of prosperity. Now more than ever, it is vital that all states seize the opportunities to learn from each other, to increase their prosperity, and share their experiences with one another to help them improve.
Thank you for that, Stephen, and I hope everybody enjoyed the video. I'm now going to invite Shaun Flanagan, the director of our Centre for Metrics, to unpack the US Prosperity Index in more detail and offer some insights into how prosperity is evolving in Iowa.
Thank you very much, Joe, and good afternoon, good evening, everybody. As Joe said, my name's Shaun Flanagan. I'm the director of the Centre for Metrics at the Legatum Institute. And I just want to draw your attention to some of the sort of findings for Iowa today. But before I do that, Stephen mentioned earlier that we developed this taxonomy for the US and how to measure prosperity across the US. And I'd just like to take this opportunity to thank the 40 experts that helped us design the US Prosperity Index in creating the overall taxonomy, but then also helping select and identify the indicators that would best help measure those 48 policy-focused elements, which has resulted in around 215 indicators underpinning the index. So what does the US Prosperity Index tell us about Iowa? Well, this first slide here, which hopefully you can see, shows where Iowa positions in the rankings 1 to 51 in the United States Prosperity Index at a state level. So overall, Iowa's prosperity ranks at number 20th. But then as you cast your eye across the table, you'll see that Iowa performs different levels of performance depending on each pillar. So it performs particularly well in education and social capital, ranking 10th. But then when you look at business environment or the natural environment, it ranks 40th and 42nd. So what's happened to prosperity across Iowa over the past decade? Has it improved or deteriorated? Well, Iowa has seen an improvement in its prosperity over the past decade. It hasn't quite improved as fast as the overall US average, which is the orange line. But then on the right-hand side of your screen, you'll hopefully see a bar chart that shows how that improvement has been made up. So the first three bars looking across the open economies domain has been an improvement across all of those areas. But when we look at inclusive societies, we see that safety and security has actually deteriorated, as has social capital, which you'll remember from the video Iowa is one of many states that has seen that deterioration. And then across the empowered people domain, we see that living conditions, education and natural environment have improved, whereas health has slightly deteriorated. So I just want to walk you through now 3 examples from across the 3 domains to try and showcase how the index can be used. Now, I apologize in advance because these slides are fairly data heavy, but hopefully I'll take you on a journey that you can follow me as I go. So the first example is where does Iowa have a strength that another state could learn from? And this is sort of piggybacking, as it were, on that final message in the video about every state has an opportunity to improve in one area or one pillar of prosperity, and that opportunity to share and collaborate. And then the second example is looking at where is there a weakness in Iowa where it could learn from another state. And then the final slide analysis I just want to talk you through is it was health in Iowa, particularly as we look at the backdrop of the pandemic. So let's look at this first example, which is around social capital. So what you see here is overall social capital, Iowa ranks 10th, and it's fallen 5 places in the rankings over the past decade. Underneath that, you see the 4 elements that Stephen was talking about earlier: personal family relationships, social networks, institutional trust, and civic and social participation. You see the fall in 5 ranks overall is predominantly due to the fall in institutional trust. This is the trust that people have in the sort of formal institutions, so that would be around federal government, the media, sort of corporations. That has seen a deterioration. But when we look at personal and family relationships, we see that actually that has seen an improvement over the past decade, and consequently Iowa has risen 2 places in the rankings. But what underpins personal and family relationships? Well, what you see here on the right-hand side is the 7 indicators that underpin or that best measure personal and family relationships. So we see here that Iowa ranks particularly well on the indicators on divorce, parents' attendance at children's activities, and sort of having shared meals with household members. And in fact, on all the other indicators, it also ranks in the top half of the table. So that's a particular strength. But where do we see another state where perhaps personal and family relationships are not so strong? If we have a look at Missouri, for example, we see that whilst Iowa ranks 2nd for personal and family relationships, we see that Missouri ranks 28th. And then when we look across at the indicators that underpin this, we see a stronger performance by Iowa on nearly all of these indicators, particularly those ones on the screen. So we see that Iowa has lower divorce rates, lower teen birth rates, but also higher sort of prevalence on these indicators around family structure. So what is it that Iowa is doing that perhaps Missouri could learn from? What could it learn as it looks to help strengthen its personal and family relationships. So that's the first example on inclusive societies. Let's have another look at another example. This is on the open economies domain, and this is where Iowa is perhaps not performing as well as it could, and where perhaps it could learn from another state. So if we take the business environment pillar, so here again, we've got the 4 elements that underpin business environment. And we see that actually it's fallen 1 place in the rankings over the past decade and currently ranks 40th. But if we look at the first element, financing ecosystems, whilst it has seen a small improvement over the past decade, it still ranks 42 out of 51. So let's have a look at the indicators that underpin that particular element. And here, this is looking at the extent to which a state can direct investment into it. So that's through venture capital or foreign direct investment. Now, as you glance across the table, you see that Iowa has actually had some improvement across these indicators over the past decade. But because the improvement is not greater than that seen across all states, it's kept its relative ranking. So where is there another state that we've identified from the index that is performing more strongly on this particular element that Iowa could perhaps learn from? Well, if we have a look at Wisconsin, for example, we see that whilst Iowa ranks 42nd on this particular element, Wisconsin is 20th. And then as we again look across at the indicators, so the first 3 charts there at the top are around venture capital, and then on the bottom it's foreign direct investment, asset under management, and bank branch access. We see that all of these indicators is where Wisconsin outperforms Iowa. So what could Iowa learn from Wisconsin about attracting higher levels of venture capital or foreign and direct investment? What particular strategy is it employing there that perhaps Iowa could learn from? The final example I just wanted to look at is health. So there are 6 elements to health: behavioural risk factors, preventative interventions, care systems, mental health, physical health, and longevity. And I just want to look at 2 separate elements here by way of contrast. So if we look at care systems, we see that here that in particular, Iowa performs very well on 3 of these indicators. So over the past decade, there has been a good increase in the number of adults with healthcare coverage. We also see that there's been a reduction in the number or the percentage of people that have avoided medical care due to its cost. And also hospital ratings have improved. So it feels that ranking 5th overall for care systems, it feels that Iowa was well placed before it headed into this pandemic, perhaps better placed than a number of other states in order to deal with what might unfold. But another area within this particular, and this shows the sort of diversity of the pillars, is looking at mental health. So these are the indicators that underpin mental health. So overall, Iowa ranks 14th. So it's not a bad performance or a poor performance by any means, but it has seen a deterioration in the mental health of its residents over the past decade, which from the video you'll remember is similar to other states. But in particular, suicide rates have increased over that time. And serious mental illness still ranks 23rd. Obviously, as we headed into the pandemic and as we're in it now, there's a lot of anxiety created around the pandemic, but also, as people lose their jobs or are furloughed, that again is also something that can really sort of increase or actually be a factor in terms of affecting people's mental health. So that would be an area of concern. And I'm sure Iowa, like many other states, is providing supportive services to its residents to help them during these difficult times. So I just gave them 3 examples there at the state level in terms of how you might use the index to identify strengths and weaknesses of a particular state. And as Joe, I think, mentioned earlier, there is a profile for all 50 states and DC, which provides all the detail of the index, so you can really drill down and interrogate the detailed information on where a state is strong and where a state is weak, and where another state may be showing strengths or weaknesses that they could both learn from. So I wanted to just conclude the last few minutes, as Joe talked about, on our county analysis work that we've been doing over the past year, focusing on 8 states. So this slide here just shows the 8 states that we've been working on doing the deeper dive, as it were. So we've been doing New York, Georgia, Iowa, Oklahoma, Texas, Colorado, Montana, and California. And what we've done here is we've looked to mirror the state level index in terms of its construction. But obviously, as many of you will know, data availability at county level is less, and it's not so prominent. So whilst we've been able to get 132 indicators that have county variation of some form, so that could be county level data or data at metropolitan statistical area, for example, we are also using 83 indicators that are statewide. And some of these are indicators that is appropriate to use at statewide. It could be state regulation, which would be equally applicable to all counties, or it could be occupational licensing, again, which may be applicable. But there are some indicators in here where we would ideally like county level variation, but it's just not available yet. So this shows how prosperity maps across these 8 states, looking at all 829 counties, grouped into quintiles. So what will strike you immediately as you look across here is that there are some states with greater heterogeneity than others. Some states are fairly homogeneous in their performance of prosperity. So for example, Iowa, Colorado, and perhaps New York, whereas other states such as California, Montana, and Texas have greater variation in prosperity across the counties. In some places, there are clusters of prosperity, and often that exists around urban areas or urban counties. We see that particularly in Texas. And whilst there is a general urban-rural divide, we also find that that isn't universally the case. There are some rural counties which perform very well. And in fact, many can outperform urban counties as well. And we explore that in further detail in our report, which will be coming out in July, where we've got 3 essays looking at the archetypes of prosperity across counties. So I want to spend a couple of minutes looking at Iowa in particular. So what you have here on the left-hand side is the strongest performing counties, and on the right, the weakest performing counties. But all counties either appear in the top quintile or the second quintile. When we look at that, how that breaks down across the 3 domains of prosperity, we see that there is some greater variation. Whilst inclusive societies, the top left, counties perform very similarly. They're all grouped in the top 2 quintiles. When we look at open economies, we see that isn't the case. We see there's much greater diversity, and perhaps not a surprise, around the more urban areas is where counties perform better. At the bottom of the screen, you'll see that there are those counties. Actually, there are some that fall in the bottom quintile. And what we find here, that generally speaking, is that these counties have high levels of unemployment, lower levels of business startups and entrepreneurships, as is measured in the economic quality pillar. And then the top right is how counties perform in the empowered people domain, which is broadly similar, although there are some that are in the middle quintile. And how has prosperity changed across these counties since 2010? So what you see here is all but 2 counties have seen an improvement in their prosperity over the past decade. So as you see that Shelby, Howard, Washington, Adams, and Hardin have seen the biggest improvements. And Grundy and Decatur are the 2 counties that have seen a deterioration in their prosperity. Grundy, for example, has fallen due to institutional trust in particular declining, as both confidence in the media and corporations has deteriorated. So what I've just shown today is a little bit of what's possible through the index at both state and county level. Hopefully that you've got a bit of a picture of how Iowa is performing across the 3 domains, and with some examples of strengths and weaknesses and areas that could be improved, or where it could perhaps educate another state. So what we'd really like to just conclude you with is that these indexes are open source, they're fully available, they're on our website, www.usprosperity.net. And our sort of call to action really is that state and county leaders use these index to help sort of develop and deliver data-driven policies that will deliver even greater prosperity for all Americans. Thank you very much.
Thank you, Shaun, for that. We hope that these presentations have demonstrated the power and the relevance of the index, and not least in the wake of the health and economic consequences of the COVID pandemic and the wider social challenges that have resurfaced across the US in recent weeks. We hope that you also feel a sense of optimism for the opportunities that there are for Iowa to emerge more prosperous from these challenging times. To discuss some of these challenges and opportunities in more detail, we can now turn to our panelists to offer their reflections and thoughts. So, Christina Moffatt, if I can come to you first. You serve as the Director of Small Business Resources at the Greater Des Moines Partnership, and you're also a small business owner yourself. How do the index's findings on the business environment in Iowa resonate with your own experiences? And what do you think needs to change to increase prosperity, particularly in the state's urban areas?
Yeah, so I think the findings were a little shocking to me. Being a small business owner and working with small business owners in an urban setting, I would not have guessed that we would have shown the decline that we showed. However, I'll let my counterparts weigh in as to what's happening out in the rural, because as I do travel, I cover 8 counties in Iowa. I do see major differences on what's happening in urban versus out in the rural. But several of the things that were mentioned, were the accessibility to venture capitalism, things like that. I think that we are trying to move in the right direction to position ourselves. We do look at Wisconsin a lot, so I'm glad that you used that as the example. That is someone that we look to often. In my situation, I do deal more with the Main Street businesses. I do have a counterpart that works directly with tech companies that are able to receive venture capitalism. But myself, with businesses taking out loans, a lot of them, choose to bootstrap it versus actually going after capital. So that did not surprise me that that would be a lower number. The other thing that we see is that businesses sometimes start when it fits in their lifestyle and it's a shorter duration for them, such as they might have chose to start a business from their home while their kids were young so that they could balance both. So that doesn't surprise me either. But being in the urban setting, the one thing that I would agree with is that our regulations, we have our state regulations, our county regulations, and our city regulations to get businesses up and going, can be cumbersome. The positive thing I saw through COVID is that all of these city regulations, county and state, moved so fast to allow our businesses to change and do business as they needed to. We saw things turning over with the Iowa Restaurant Association in 24 hours, which has never been done before. So for me, that is promising going through COVID, that we'll be able to get things through regulations quicker on the back end of this. The other thing that I think, just from the rural piece that I cover, is that when we look at family businesses, we see children not necessarily returning to Iowa to take over those businesses. Therefore, the business goes through the process of, are they going to sustain? Are they going to vacate? Are they going to sell to an employee? So sometimes in those smaller towns and counties, we don't necessarily see the businesses turning over like we would. Even Des Moines has some of that as well, as they've seen their parents work in the business and it's not something that they choose to do. But again, I'll let Dr. Mueller and Bill weigh in on those as well. But that is just my personal experience in working with transitioning businesses to the next generation or the new owner. But again, I was a little surprised by the results, but being in an urban setting, I just have a different experience than living out in rural Iowa and seeing that on a day-to-day basis.
Christina, thank you so much for that and for your sort of frontline experience. That's really valuable to us. Keith Mueller, coming to you next. As the director of the RUPRI Centre for Rural Health Policy Analysis, you're obviously particularly focused on the challenges facing rural communities. And we're obviously living through a major health crisis at the moment. The index showed that health had declined overall in Iowa slightly over the last decade. What do you think are the particular challenges in this area, and how could the state emerge more prosperous after the coronavirus pandemic?
Well, to answer your question, I would start with one of the strengths of this index, and that's the ability to look not just at health in isolation, but to see all of the indicators across the domains of the index in one aggregated way, and also being able to separate them. I start with that because one of the areas of decline in Iowa, and we're not unique, as the national map also showed, a national set of indicators, are dimensions of health like mental health, including the indicators around drug overdose, serious mental illness, self-reported mental health not good, and in some of the indicators related to longevity. And those are driven a lot by factors beyond the control of the immediate clinical system that we usually think of with health. So it's really important to know more about social capital and economic and even the natural environment to help explain what's driving some of those indicators. The other message that comes through from the index is Iowa's strength has always been in its healthcare delivery system. We're blessed with a really good, robust network of providers across the state in a range from primary care to quaternary care, from the small rural practice, many of them still independent, to the large university-based practice that I'm next to. And so you see that emerge in the access measures and the care system measures. We've always paid attention to the uninsured and financial access, and we are a Medicaid expansion state. So the strength of those indicators, but as you pointed out, or as Shaun did, even those have declined a little bit with the advent of the pandemic. And so we've seen some deterioration in the insurance coverage here, even in Iowa, where again, we're strong. And we've seen vulnerability, not yet a crisis situation in the delivery system, but a financial vulnerability that was exposed when, because of the pandemic, we stopped elective procedures in all of our hospitals. And that affected, for example, rural hospitals in particular that operate on very thin margins that had no replacement income for that, and were not eligible in the first wave of the federal funding for hospitals, because it was driven by how many COVID patients have you had. And of course, the pandemic focused in urban areas initially and has spread now into some rural areas. So the strength of our system was helpful to us coming in and going through. The pandemic also exposed one of our weaknesses as well.
Thank you, Keith. That's really great. Really appreciate your insights. And then finally, turning to you, Bill Menner, as Executive Director of the Iowa Rural Development Council, I know you're particularly interested in community-based infrastructure, housing, and healthcare. How have you seen prosperity in Iowa change over the last decade? And how do you think different stakeholders can now come together to build a roadmap for future improvements?
Well, it's interesting that we have 2009 as the starting point for this benchmark comparison, because of course we're in the midst of the Great Recession at that point in time, and we've had a chance to see how our state has rebounded or not, and we know for the most part that urban areas rebounded more quickly and more wholly than rural places did. But putting on my economic developer hat, we're always looking for tools. We're always looking for ways to measure, whether you call it livability or quality of life or prosperity. How do you put those terms into context? And I think that when you're able to dig down and look at the factors that influence where people choose to live or where companies choose to locate or to stay, how do we measure how small towns and rural places compare not just with each other, but with the urban areas, or, as you've so nicely done, looking from state to state? And how do we track progress? What really are the trends? I think that what rural economic developers often face are challenges with how do you glean that sort of data, whether you're looking at Census Bureau figures or state data or local labor sheds or the sorts of surveys and rankings that we see sometimes from other institutions. How do we gather that and use it most effectively? And you know, there were a few things that surprised me when I looked at our state versus others. There were others that didn't. For example, you know, venture capital is something that you don't see flowing into most rural places. It's still an area that challenges us. There are good venture capital networks in some of the urban areas, and there are leaders in Des Moines and Cedar Rapids and Iowa City that are doing a nice job leveraging outside investments. But boy, it's hard to find in rural places. Access to capital is a challenge in rural places. And again, that's probably not unique to Iowa. If you leave the coasts, you'll probably bump into a lot of small towns, and your index will, I think, demonstrate that, whether you're looking at Iowa, Nebraska, or Wyoming, or wherever. There are going to be challenges. But I think what we can do with this sort of information is help make it available to economic developers and local leaders and people who are developing policies to improve not just our business standing, not just our healthcare standing, you know, but that overall livability of how do we live our lives and what does it look like and what makes our places or our spaces so special. So, you know, I look at this as having more data, more information. Information's a very good thing. And the next step is how do we get that out there? And how, I think a really important thing is building the capacity of local leaders, especially in small towns, to look at this, understand it, and respond to it.
Thank you, Bill. Really appreciate that. And we would definitely agree in terms of the importance of information and data. So thank you. Thanks to all of our panelists and speakers for those remarks. I'm going to move now to address some of the questions that people have been sending in for everybody. So I might start, Shaun, by coming to you with a technical question that a few people have chipped in with, which is, how much does the index disaggregate data in terms of race or gender or age or other demographics?
Yeah, that's a great question. And I think that's something that we've been aware of as we've been building this index. We had some workings with Robert Wood Johnson Foundation as well when we were constructing this in terms of their county health rankings. And I know that's a challenge that's been put to them as well, which is, I think it's, the idea would be that yes, we could, but the challenge is the availability of data, which is always particularly challenging, perhaps surprisingly challenging. I mean, obviously the US at the moment is, you know, a challenging time going on, but that's sort of rippled across other parts. But one of the things we sort of found difficult when we came to do the state index was that looking at indicators perhaps around racial discrimination, there's very little information available. Whilst there is a national survey that's done by Pew, which is very good, we couldn't find very much at state level data. So what we actually did in Personal Freedom Pillar is we've created our own index around what we call ethnic slurs. And this is where we're using Google Trends to look at the extent to which derogatory search terms appear. And we've sort of captured that, which has allowed us to sort of create a sort of ranking of across states. But it is a challenge, I think, across other areas of the index. What we do find is that when we look at things, living conditions around material resources and poverty rates, we find that actually certain groups in society which are perhaps more disproportionately represented in those areas. So that would be an area where a state would need to invest and supplement it with more qualitative local information to really understand which particular groups of society are most affected by that and therefore address. So it's kind of woven into the index, but it's not disaggregated in the way that perhaps we would ideally like.
Thanks for that, Shaun. Christina and Bill, I might come to both of you next. Maybe Christina, you first, and then Bill. We've had, I think, 3 or 4 questions really picking up on this issue of investment and business investment, with Colette Jordan-Bow kind of highlighting the comparison with Wisconsin. And people asking, what is it that means Iowa is not embracing FDI and venture capital as much as it could? And what policies or actions do you think would help improve this? So small questions there for you. Christina, if we can come to you first, and then Bill, maybe if you could chip in afterwards.
Sure. I don't think that it's that we don't embrace it. So for example, here in Des Moines, we have 2 different accelerators that have happened. So we have people from all over the world. We have the insurance accelerator here, and we have the ag accelerator. So we have people coming from all over the world to be here. And those get a lot of attention from outside groups for venture capitalists. I think that because I don't deal with the venture capitalists day in and day out, and I deal with more of the Main Street businesses that are pursuing the bank loans, the sheer amount of collateral that you have to have on a bank loan is quite a bit. And when it comes down to it, most people who own their home is going to become the collateral on that loan. So if you're looking to build out a restaurant and the restaurant's going to cost you $400,000, the only thing the bank potentially has to hold is your home, which probably is not even that amount. So when it comes down to talking to businesses about signing on the dotted line that your home is going to be collateral, that tends to make them back up and decide to maybe go a different route. So instead of going into a full-blown restaurant, maybe they back up and start to do catering or food truck or lessen their risk, if that makes sense. So I don't think it's the case that we're not embracing it. I feel like it's the person's willingness to take on the risk. And I do feel like, unfortunately, a lot of the tech companies that I have seen be successful, a lot of times get pulled out of Iowa. So once they're pulled out, that money is not traced back to them being located in Iowa anymore. It goes to California, or Wisconsin, or wherever they choose to go to, if that makes sense.
So let me turn it around a little bit, and I agree completely with Christina. It's not that we don't embrace venture capital. It's that venture capital may not always embrace Iowa, and Iowa, entrepreneurs and Iowa startups, and maybe that's partly cultural. Is that the things that are being developed here in the Midwest may not resonate with some of the East Coast or West Coast venture capital firms. That said, I think the opportunity that exists, and we've been talking about this for 20 years, is biotechnology and value-added agriculture. And how do you leverage the assets that we do have from our ag production preeminence and convert that into new technologies and new products? So, but again, that's been going on for 20 years. These conversations go on, and we still struggle to get the venture capital, not as much as we used to. It may have ticked up some in the last 10 years, but it's still a challenge, and we know that there are lots of folks working on this. So how do we tell the story better is that maybe we need to do a better job of describing to people outside of Iowa what the business climate is here and what those sorts of innovative startups are.
Yeah. Thanks, Bill. Thanks, Christina. Shaun, if I can come to you, Dr. Dawn Sawyer has asked how Iowa compares to some of the states at the top of the index in terms of health and well-being. Could you maybe pull out a couple of key highlights there?
Yeah, so as mentioned during my presentation, I mean, Iowa it ranks 11th overall for health, so it does well. It's in the top 5th nearly of the index. But if you look across those states that are sort of top the index, it's actually Hawaii tops the index on health. It actually performs best on behavioral risk factors, actually on care systems, but also well on mental health and longevity. Whilst it has seen a deterioration in physical health, it's now 15th. It was 11th back in 2009. But other states that do well on health are Connecticut and Minnesota. Yeah.
Thanks, Shaun. And Keith, if I can turn to you, sort of continuing the health theme, a couple of people have highlighted the findings on mental health decline being really stark. Do you think there are quick wins on this, or is that sort of issue really a long-term slog, is how one of the questions put it? And also, how much of the change do you think needs to be driven at a federal level, and where is it a sort of local approach that's needed?
Well, my reaction to the last part of that question is this is an all hands on deck situation. That there are federal policies and particularly investment strategies to support mental health, but a lot of the intervention activity, and going back to what I said earlier, addressing the underlying conditions that lead to it, we need to understand those in a more local context. And I'll just give you one example. When we think about drug overdose deaths, right now the nation's attention has been focused on opioid use. But here in this region of the country, our attention continues to be focused on methane and other drugs, not just opioids. And in fact, the other drugs are more of a problem than opioid. So you need that local understanding at that level. You need a coordinated approach. Iowa has been dealing with this as a policy issue for the 10 years that I've lived in the state, because we're one of the states that has tried to transition from an old institutional-based approach to dealing with mental health to a more decentralized into the community-based. And this is true beyond just Iowa, that transition has not gone smoothly anywhere, and it certainly has not gone smoothly here. And that is more of a state than national issue.
Thanks, Keith. Appreciate that. Stephen, picking up maybe a little bit to a broader perspective, one of the questions is kind of how comparable the US state rankings are to our global rankings, and which country Iowa is most like.
Thanks, Joe. Yes, it's an interesting challenge because obviously within the US we've got wide variety of performance. Norway tops our global list, and I wouldn't say that any state in the US is quite as good in prosperity terms as Norway, but coming down to about fourth place, Massachusetts would probably come in at about fourth in the world. And Iowa might be a little below Germany or so. And given that Iowa's 20th in the States, it's slightly above the United States 18th ranking. And then towards the bottom of the rankings, Mississippi would be the equivalent of Portugal. I think that's a useful sort of bearing, because I think as people might look at Mississippi and think, if that's sort of the weakest performing state, give or take, if that translates across to Portugal, I think Portugal probably is seen, is well regarded. I mean, it's an EU country, long-standing member of the OECD. The range, therefore, for the United States is actually a very high one, so I think there's a lot of hope and there's a lot of potential throughout the states, but they would be the ranges I'd be looking at.
Thanks, Stephen. And Shaun, just a question thinking about Iowa specifically. How secure would you say, sort of from the index data that we've seen, how secure is Iowa's current prosperity? And are there any particular states that it should be sort of aspiring to be like? No, Shaun, I don't know if that question came through to you.
It did. So sorry, I was on mute in full flow. Yeah, I think there are plenty of areas within the index that where Iowa performs well, and I think it should have confidence in those strengths. So economic quality 13th, personal freedom 12th, governance 11th, social capital 10th, and even across empowered people, it does well on 3 of the pillars. There are areas, where it could, and I think the first thing is to continue to build on those strengths and not neglect to continue to do what it's doing there. But I think around the business environments, perhaps market access for infrastructure and the natural environment we've talked about are areas where it could improve. Obviously, Iowa as a heavy agricultural industry, and I think when you look in the index, there are some things around pesticides which could be addressed. But the idea with the index is that it can look across to other states. We've already mentioned Wisconsin as an area there as a state that's already looked at. So there may be other states that could sort of look to address those challenges or those weaknesses where it's not as strong as in the other pillars. But I would say, Joe, just to conclude, I think it's not about becoming another state. It's about building on what makes Iowa strong to make it even stronger.
Great, thank you. We're coming towards the end of the event, so I'm going to do a final question to all speakers and panelists, and we'll go in original speaker order, so from Stephen on down. And I guess that's sort of a summary question really that's come through in terms of, if you could pick just sort of one thing, where would you be encouraging policymakers and policy influencers across Iowa to focus their efforts to see prosperity improve? So Stephen, if we can come to you first.
I'm going to cheat slightly, but I'll pick up really and focus on what Christina was focusing on to start with, which I think is still these questions of what does it take to attract investment and capital into the state? Because I think answering that question will be the key to unlocking a lot of other things. But I would add the other, my joker here is institutional trust in government, trust in the media. That has declined a lot. And I have seen, when I look globally and on other measures, that getting institutions working well, getting them trustworthy is also a critical key to unlocking a lot of other successes. So I'd be saying, find out what it takes to bring capital in. I mean, Christina and Bill have already talked about it, but also just take a good hard look at ensuring that the institutions in the state are not just trusted, but that they are trustworthy. That's the thing that policymakers can do. They can make them trustworthy, and then the trust should flow.
Thanks. Shaun, over to you with the same question.
I think Stephen stole mine, but I will find something else. I think when we look at health, where I would say over the past decade is around the behavioural risk factors. So that's when we look at things like sort of levels of obesity, as well as also ability deterioration, and could be an area for
I think we seem to have lost Shaun. So Christina, if I can come to you, and we might try and get Shaun back.
Sure. Sure. I think that one thing I kind of touched on, but that we saw happen, and it was a positive out of COVID, is how quickly government regulations moved to be able to help our businesses, and that it wasn't a lot of red tape and things like that. So I hope moving forward that is something that we can continue, because I think that unfortunately the reality is some businesses are not going to make it. So how fast can we get things stabled and the economy keep going, get those jobs added back in if businesses do close down? I think that was just a huge win for us. Here, there was state policy as well as local policy that helped small business. I do agree that we need to, again, Iowa is humble. We don't like to go touting ourselves, but if we want to attract that venture capitalist, as was mentioned, it's something that we do need to talk about, but not only talk about it, but retain them here in Iowa. Because unfortunately, a lot of the venture capitalists do like to pull them out to a bigger city. So convincing the venture capitalists that Iowa is full of opportunity and it's okay for them to stay here is something else that needs to be on the table as a conversation.
Great, thanks. Keith, over to you.
I think building off of our strengths, and what I talked about earlier, we have a very strong delivery system on the clinical care side. If we continue to evolve our thinking beyond clinical care to the other dimensions that affect people's health, excuse me, getting those systems to engage not just in the conversation, but in a meaningful way to lead us into policies that approach health holistically, including the factors that Shaun was trying to talk about on the behavioral health side, would move us forward.
And finally, last but very definitely not least, Bill, over to you.
I think if we have a recognition statewide among policymakers that strong businesses and good paying jobs and good communities and access to available affordable housing and transportation all have health income or health impacts. If you can address what we know as these social determinants of health through strong business and strong communities and strong hospitals and strong schools, but that requires an understanding that government has to play a role. And that's why faith in that governmental institution has to be probably has to be stronger, because it's kind of an all of the above approach to this.
Our hour is just about up, so I'm going to bring the Q&A session to a close there. Thank you to everybody who sent in a question. Apologies if I wasn't able to ask it, and a huge thank you to the speakers and panelists for sharing their thoughts. One thing that a few people have mentioned is whether we are going to expand our county analysis out beyond Iowa. The answer to that is yes, we would love to. We've been able to focus on 8 target states for the moment, but we are hoping that we will be able to bring more in until we're able to do all of the counties across all of the states. We really hope that you found this afternoon and this evening's presentation useful. On the screen you can see our website. Please do check out the information on there. It includes our reports, thought leadership essays, and also a profile of every state with an easy overview of all the data. We're also hosting a variety of other webinars, including one at 10:30 a.m. tomorrow morning Central Time. This is in partnership with the Brookings Institution to discuss the national picture in more detail, so do join us for that if you would like to. We create our indexes, publish our reports, and hold our events in order to help leaders and influencers at every level identify the practical solutions that can deliver real and lasting prosperity. We are hugely ambitious for the United States and for Iowa, and therefore we'd invite you to make full use of the index and the related resources. They're all free on the website, so that you can help set the agendas for growth and development. And together, hopefully, we can create roadmaps to improve institutional, economic, and social well-being for the whole of Iowa and for all Americans. Please do get in touch with us if there's anything that you'd like to discuss further. Otherwise, just say thank you for joining us today. It's been a pleasure to bring you all together. And a special thank you again to our distinguished panel of speakers for giving up their time and for their insightful comments. And I hope you have a wonderful rest of the day. Goodbye.